So in this video we're going to look at the spinal COGs in a transverse plane, so it's in a rotational plane. The exercise I use for this is very similar to the other ones, but we're just focusing on rotational movement. So again, we think of the pelvis and ribs moving in opposition. The simplest way to do this as I lie down is let the knees fall to one side as the ribs stay relatively still. They stay glued to the ground, and then bring them back up. So the important thing to remember here is the breathing. We want to map everything we're doing in terms of COGs to our breathing phases if we can. And so an inhale is going to correspond with a drop to the side as the belly expands, and an exhale is going to correspond to drawing the knees back and the pelvis back to a center position. So the exhale focuses on contracting the abdominal muscles and drawing them in, which is going to help with bringing that pelvis back to our starting position. And so you're going to do both sides. As you inhale, you're going to drop. You don't have to drop all the way to the side. You can drop just, a few inches or whatever is comfortable, whatever you can do pain-free, that's what you do. As you exhale, you're going to bring it back to your starting position. So inhale, drop, pause, exhale, bring it back, pause, inhale, drop, and pause, exhale, and pause. So you want to get into a nice rhythm. It should be comfortable, it should be fairly effortless, it should be really smooth. That's what we're looking for. We're not looking for a stuttery drop to the side and then like a heave back to center. We're looking for a really nice, so we're exploring the ranges of motion, going from this end to this end, nice and smooth, in sync with the breathing. It's going to allow your brain to kind of regain those movements and feel safe in what it's doing.